telehealth bloomed before we took off, but it wasn't blooming for specialty care. It was there for primary care and urgent care needs primarily. The frustration was we thought, man, specialty care is such a good use case for this. Specialists are the hardest ones to access. Let's get there. Why isn't this market understanding that? And the answer is that markets can be unpredictable and take more time than you rationally think they should. The specialty market then emerged and said, yes, access is the problem we want you to solve. And finally, Heartbeat was right there, first in line to say that is our model.
Welcome, MedTech Gurus. Today, as I mentioned in the introduction, we have a special guest with us, Dr. Jeffrey Wessler, CEO and founder of Heartbeat Health, joins us to explore how virtual-first cardiology is helping solve one of the most pressing issues in healthcare today, that being access, timely, and life-saving heart care. Dr. Wessler is a board-certified cardiologist, former Columbia University faculty member, and a recognized leader in digital health innovation. He completed his training at Weill Cornell, NYU, and Harvard, and has been featured in Forbes, CNBC, and the American Heart Association for his forward-thinking approach to cardiovascular care. Through Heartbeat Health, he's addressing rising wait times, which according to our research now averages over 32 days to see a cardiologist, by using virtual care to deliver diagnostics and treatment faster and more efficiently than ever before. Hey, Jeff, are you ready to be our guru today?
I'm ready, Tom.
Oh, that's awesome. We're excited to have you. So tell us something fun or interesting about yourself or your family so we can get to know you a little better.
Yeah, sounds great. Well, first, thank you. It's wonderful to be here, and I really look forward to the conversation.
Mm-hmm.
Let's see, what can I tell you? I've got a couple young kids, 5 and 7, enjoying a summer here out in New York, where I live. My kids who have seen me build and now run a telehealth company have started referring to me as a pretend Zoom doctor. So I suppose that's their new branding of my life.
Yeah, leave it to children to bring it down to the lowest common denominator, right?
That's right.
That's funny. So Jeff, first of all, you've trained and practiced at some of the top institutions in the country. So I'm wondering what led you from the clinic to launching a digital health startup. Can you provide us some insights there?
Yeah, I can. So let's go back to 2017, which was when Heartbeat was started. I was at Columbia at the time, and Columbia is, this wonderful cardiology health system and hospital, but it sees very, very sick patients. In fact, it's known for seeing the sickest and sickest of patients. And as I was going through this care and practice model, I could sense there was a burning and growing issue that just kept gnawing at me, which was there has to be a way to get to these patients before they get so sick. And we have built as a health system, especially in cardiology, we've built a system that does an amazing job of treating patients when they're incredibly sick. But conversely, we have done, I'd say, a pretty terrible job of treating patients early and upfront and getting to them before they get sick. So this moved from being a thorn in my side to saying this is something I've got to spend a life and a career working on. Fast forward 8 years, we spent a lot of time, I'm sure we'll talk through some of it, on iterating on that model, but ultimately I had to step out and build something that would address what I thought was the next generation problem in cardiology, which was getting to patients before they get so sick.
Mm-hmm. Yeah, that's really helpful. And to build on that, as I mentioned in the introduction, it appears that it's taking like 32 days or so to wait and get the chance to see a cardiologist. So obviously that's a serious issue. So how does your team at Heartbeat Health address these gaps in access and improve patient outcomes?
Yeah. So I think just to emphasize how concerning this is, and that 32-day stat is real in many places, many counties across the U.S. It's much, much worse than that. Mm-hmm. Imagine what it's like to have a cardiac issue, have coronary artery disease or high blood pressure or some symptoms like palpitations or breathing issues. Put yourself in a patient's shoes. That those are very serious. They could end up being a really serious cardiac condition, and waiting a month or 2 months to get those seen is not only incredibly dissatisfying from the patient experience, but potentially very dangerous.
Mm-hmm.
So we came at that problem and said, first and foremost, let's solve the access problem and make sure that that patient, wherever they are across the country, can get access to a high quality cardiologist. And our best answer to that was telehealth. Telehealth lets you see someone via video visit anywhere in the country from any place, from the couch of your home or in a primary care clinic. But it doesn't have that requirement of you've got to go one patient at a time into a brick and mortar cardiologist office. So our seemingly simple solution to this access problem was, let's build a telehealth model that brings high quality cardiology right to your phone or your computer or your iPad.
Yeah, that's fantastic. So, what's part of that gap? Is it the referral from maybe a primary care physician to a cardiologist, or are patients just waiting too long and delaying the inevitable?
That's a great question. I've learned never blame the patient for anything. So, waiting if someone's waiting too long, then that's not the patient's fault. It's us. It's the system's fault for not making it clear that you can't just treat the symptoms. You have to find risk factors before they develop into symptoms. I think part of the gap comes from the referral pathway is very complex and hard to navigate. Part of it comes from there are just not enough specialists to take care of the growing number of high-risk cardiac patients that exist. Cardiac is not the only specialty like this, but it's a serious one and a serious issue there. And then part of the gap comes from, really we have a hard time prioritizing preventive care and early identification and management of disease. It is much clearer that when you've got chest pain, you've got to go to the emergency room, but it's a lot less clear that when you have rising blood pressure and your weight's going up and you're still feeling a little fatigued and your cholesterol's rising, that those are things that need to be treated very seriously and pretty aggressively if you're going to prevent that heart attack down the line.
Yeah, gotcha. That's helpful. And so maybe it would be useful now just to walk us through how Heartbeat Health's platform works, right? From diagnostic to treatment. How does it integrate with some of these traditional healthcare systems? So give us some insights so we can understand how that model's working.
Yeah, so think of us like a practice in the clouds. We're a care delivery organization, so we're not an app or we're not a website. We are a clinical practice that includes advanced cardiologists, general cardiologists, advanced practitioners like NPs and PAs, nurses, care coordinators, medical assistants, everyone who you might think of as a normal division of cardiology, except we don't own any brick and mortar office buildings. So all of that care happens via technology, telehealth and remote diagnostic testing and texting and messaging patients and communicating directly with the patients, but not bringing them into the office. That is a model that now we have had to figure out, well, what's the right way to get that to large numbers of patients in need? And the answer is we bring that primarily to primary care clinics and provider groups across the country. So these are groups that are actively managing high-risk cardiac patients, but don't have the easiest access to get them to cardiology. And so we come in and say, well, we can help, and we can help be your cardiologists and do that care. And the final thing I'll say briefly is we have one of the things that makes cardiology special is the need to do diagnostic testing with almost every aspect of our care management. And this differs, for example, from some conditions like in the behavioral health or mental health space. Cardiac, you need diagnostic testing. Well, it turns out that these diagnostic tests have gotten a lot easier to do remotely. There are now rhythm monitors that we can send out to people's homes. Everyone's wearing a device that captures some sort of a cardiac indicator. Echocardiograms can be done, at primary care offices and imaging centers. So we can get those diagnostics now without having someone to come into the cardiology office, and that has really unlocked the ability to do pretty complete cardiology care at scale everywhere.
Yeah, gotcha. So, as an example, I'm thinking, let's say we had this individual, his name happens to be Tom, and, Tom's primary care provider says, your cholesterol is going up and I'm kind of concerned. So, would it be that primary care provider that would contact you? Or would they say, hey, here's a new innovative way that you might think about? How does that patient intake work from your
Yeah,
end?
that's a great question. We primarily work directly with the primary care groups and become one of, not their only, but one of their referral partners. And so, yes, Tom's primary care could use Heartbeat to refer their cardiac patients, just like they may use a different cardiologist. And we do
Mhm.
that now at a pretty high volume. What we are not doing, and this is, I think, in contrast to a lot of the preventive health and longevity practices out there, is we're not a direct to patient practice. We're not advertising on to Tom directly and saying, hey, do you have palpitations, come see Heartbeat. We work directly with the primary care, and we felt like that's the place for where we can be the highest value and actually find and work with patients who really need our services.
Yeah, which really kind of leads me to the next question, right? Because I'm thinking about remote diagnostics, as you mentioned, some of the analytics that go into this. Um, how are you finding that handshake working, and are you seeing results in terms of improving both care coordination and clinical decision making?
Yeah, this is an important point. So,
Hmm.
uh, I'll first tell you why I think it's so important.
Hmm.
Results matter more than anything in this world, and
Right.
they matter not just because that's how we prove clinical value, but there's so many interesting new clinical innovation models out there that and some of which may have made great businesses. The ones that are going to last for decades and really inflect the change of disease and improve it are the ones that bring evidence and results to the table and say this works. So from day one at Heartbeat, we've been fairly relentless about studying what we're doing and bringing evidence to the table to say this works, this doesn't work, so throw that out, try something new, try something different until we find the model that works. And study and publish on that. And so we've tended to focus on three different outcomes. The first, as you said, are operational. Does the model work, and can we get people in quickly? Can we make sure that their care is getting completed? The second is clinical outcomes. Are they doing better? Is their blood pressure controlled? Are they avoiding heart attacks? Are they staying out of the hospital? All of the things you would want need to happen, otherwise something's going wrong. And then the third is really cost and satisfaction. Is the program working both for the patients and for the people who are paying for it? Because if it's 10 times more expensive, then it doesn't work. In fact, quite the opposite needs to be true. This needs to be less expensive than brick and mortar care in order to be an effective model.
Hmm. Yeah, that's really helpful. And, a lot of our gurus and listeners out there are entrepreneurs and soon to be entrepreneurs. And I want to get into the commercialization piece, but what you're doing is really innovative. I think, you started in 2017, so you've been around for a few years. So I'm just curious how you've built this culture of innovation, right? Because things are really evolving. A lot of things going on in the community with machine learning and artificial intelligence. So how do you build that innovation culture within a specialty that's traditionally like face to face?
Yeah, I'll tell you, I've had different phases of this over
Hmm.
the years. In the early phase, I think I ingested a lot of everything out there. I read every new cardiac thing happening, every new technology thing happening, and I said we have to do this, we have to do this, and this. And it was probably not probably it was chaotic and disorganized approach to doing it. What I found in the next more appropriate phase was one of my main jobs is to be the filter of what else is happening and then how to focus that on what we need to do. And the answer is not go after every shiny object because it's working for someone else. The answer is if we have conviction that our model can or is working, then let's push into that. Let's be rigorous about studying what we do, and then grow it. And that took a lot of patience. I can clearly think through a 2-year period where we weren't really seeing the growth we wanted to, and there were a lot of questions. Maybe we should change the model. And the answer was no. This model is right. The evidence is right. We've got to be patient in the market to be ready when the market's ready. And I think that worked very well. We are now at the stage where having let the first initial wave of AI come over us and say, well, we're a care delivery org. We've got to stay a little more conservative on what we do and not just let the robots do everything. We're now starting to bring the robots in and saying there are some very real and intentional use cases around bringing AI into our model that are both very exciting, but also can help deliver better care. So I think that's been the true north guiding us: do better care, make it easier for patients to access, and the rest will follow. And if technology can help with that, then we're ready to bring it on.
Yeah, that's interesting. And I may put you on the spot here just a little bit, but I'm thinking, during that time you were looking inwardly, you were being patient, you're doing some of those studies. We often think of innovation as this big aha moment, but I'm wondering if that led you to some operational innovations that just helped in the backroom area. Is that something you found to be true?
It sure is. And I think that, I have frequently dispelled the rumor or the myth that there was this great aha moment and the next day we were a massive success. In fact, quite the opposite is true. It's really grinding through an intentional pathway to to prove the successes, drop the failures, do that again and again and again, and then not be too reactive to things that are out of your control. And operate the operational and really not so flashy stuff is the bread and butter of a clinical practice and how you make a clinical model work. And so we invested in a lot into how we think through the back office operations of our practice, and that's even more. I think that's even more important for a remote telehealth practice, because you just have to be really strong on the way everything connects so that the patient experience doesn't suffer at all in order for this model to work.
Yeah, that's helpful, and I know we'll get into this in a minute, but that had to provide some really strong insights into that patient journey, right, as they walk through that care plan. Correct?
Yeah, that's absolutely right. And one of the things I am either lucky or cursed, it's hard to tell yet, to be able to do is because I'm still a practicing cardiologist, I am frequently in doing care for our team and for our patients, and that is the greatest thing that I can do to help the company, other than podcasts like these, is to really be in the clinical experience and see how it works, so that I can be up to date on how it's working, but B, iterate on the clinical flow and the operational flow so that we can improve it.
Yeah, for sure. So I wanted to circle back now to the commercialization journey, because you mentioned you had kind of this period of slower growth, let's say. What were some of those challenges in turning that concept and creating this scalable, reimbursable healthcare solution? Can you help us out with that?
Yeah, so I think we're clearly an early innovator or bringing an early model of telehealth and telecardiology to market. Telehealth bloomed in the couple years before, before we took off, but started blooming right around when COVID hit, and we were there, but it wasn't blooming for specialty care. It was there for primary care and urgent care needs primarily. So I think the frustration was we thought, man, specialty care is such a good use case for this. That specialists are the hardest ones to access. Let's get there. Why isn't this market, understanding that? And the answer is that markets can be unpredictable and take more time than you rationally think they should. So we waited. We kept doing. It's not like we were doing nothing, but we were doing care. It was a little, a bit at a time, and studying what we were doing. The specialty market then emerged and said, yes, access is the problem we want you to solve. And finally, Heartbeat was right there, first in line to say, that is our model. If you need access to high quality cardiology, we're here for you. And, it's been amazing for me to see the floodgates opening over the last, I'd say 18 to 24 months, where everybody is seeing how valuable that can be. The patient outcomes are coming through. And, I feel very fortunate that we stayed patient through the icy period.
Yeah, that's awesome. But with that, getting that buy-in from the healthcare systems and payers isn't easy. I mean, we've had a number of gurus here talking about that. So I'm kind of curious about what your approach has been to getting traction with some of your clinical stakeholders. Can you provide us some insights there?
Yeah, so I'd say our main sales and business development strategy has been, number one, lead with evidence. Probably number 1, 2, and 3, lead with evidence. The market is having a hard time sorting through all of the different amazing ideas and concepts there, but it is not hard to sort through who has seen hundreds of thousands. In our case, we earlier this year saw our millionth patient, and what do the outcomes look like there? If they're good, then great, we'll give it a try. And if they're not so good, then we won't. So I think we have cut through a lot of that by saying this is a model that we stand behind, that independent peer-reviewed evidence stands behind, and the clinical care model works. That's what we lead with. Now, does that mean that we get yes and start the same day? No, it can still take years to run a B2B sales cycle with a big payer, and we have been doing that, and we're still in the middle of 3-4 year journeys of sales with them. But it pays off, I think, and can be immensely rewarding when you do win those, especially if you're selling a genuine representation of your clinical product.
Yeah, that's interesting, and I'm just kind of curious. Are you seeing some of that resistance more from the payers or more from the providers, or is it kind of a combination of both?
Yeah, that's very interesting. So payers and providers look more alike than they do different than ever before, and the reason for that is that a lot of payers have been buying or creating stronger relationships with providers. And so the traditional provider payer, when we started, providers and payers were kind of on different sides of the aisle. And now I think they evaluate things the same way. They understand the benefits of bringing on value, which means better outcomes for lower costs. And both of them see value in that for sure.
Yeah, interesting. And, just to build on that for a moment too, I'm also thinking, rural healthcare has been very topical in the headlines, and, we're recording this in August of 2025. So that's been a big concern. Are you seeing more of an uptake there, or is it more of an urban setting where sometimes, through population densities and equity, it's harder to get seen?
Yeah. So by the numbers, cities still have many, many, many more people that are coming through Heartbeat. But rural settings are usually where we start and where we get the most. It's the highest need traction. So these areas, there are so many counties in the U.S. with no cardiologist in a 2-hour radius. That's a desperate situation to bring a group like Heartbeat in, and so it's immensely rewarding to work in those areas, and we do a lot in that area, even though there are still fewer patients coming through at a rural settings.
Yeah, interesting. Thank you for that. So, Jeff, this really seems like an exciting time for you and your team at Heartbeat Health. What's next, and what does the future hold? Where are you going from here?
Yeah, it is an exciting time, and I appreciate you saying that. But I think I'd also emphasize that we have an immensely strong team that has been working their tail off to get this model up and going. What I think that means for the next couple years is it's all about execution, and I think we're starting to be transitioning from that startup, everyone doing everything, hair on fire all the time world to, look, we have a model, it works really well, but we need to execute flawlessly. We've got to, as we scale and do see thousands of patients every day now, the quality needs to be impeccable. We need to keep demonstrating that the results are great. And so what I would call all of that is now an execution challenge. And if we can keep up the quality and execute flawlessly, then this model's going to the moon.
Yeah, I love that. And, just as a follow-up to that from, that execution flawlessly, what are some of those best practices that you're trying to engage? Is it more around communication, or is it coming from some of the studies that you're doing? What's the driver of helping to get that done?
Yeah, it's actually all about quality assessment and quality assurance right now, which for us means a lot of different things. But I'll give you one example. When you have hundreds of clinicians doing care every day, you've got to make sure that it's very standardized what goes out, and everyone is always doing their best. But you've got people from all different backgrounds and training doing care in all different parts of the country with all different types of services and patients. So unifying that is a new challenge. It's not a challenge that it's a different challenge than, for example, a big health system faces, where everyone is in one giant building, and doing all the same thing. And so we're really investing a lot in how do we. It starts with who you hire, but then how do we train people? How do we make sure to have a rigorous process of reviewing everything that goes out the door before it goes out the door, and then assessing and reassessing how people are delivering care to make sure there's one consistent voice of recommendations and cardiovascular care.
Well, that sounds exciting and challenging at the same time.
It is.
Yeah, for sure. So, Jeff, first of all, I'd like to just acknowledge and thank you for the time and information you provided as our guru today. If somebody wants to learn a little bit more about Heartbeat Health or you, how do we connect? Is there a website? Are you on LinkedIn? How do we find out more?
Yeah. So heartbeathealth.com is our website. I'm on LinkedIn and pretty active there, so always happy to interact with people directly there. And I look forward to it. I really do like hearing from folks working tangentially in the field.
Yeah, fantastic. So, Jeff, once again, thank you so much. We really appreciated the time and information today.
Thank you, Tom. This was a pleasure.
Thank you. Thank you for listening to MedTech Gurus. I am Sylvester Harris, your MC. If you want to learn more about Tom and his consulting services, you can go to www.pctmedical.com or email Tom at tom@pctmedical.com. Now, I can be reached at Sylvester Harris, that's SylvesterHarris 5048@gmail.com, and I'd be pleased to discuss any voiceover work that you may want for your company or broadcast. Hey, thanks so much for listening, and catch us on the next episode of MedTech Gurus.